Okay, this video is going to be about wilderness first aid. This is chapter 24, and let's talk about cardiac arrest. And so CPR is going to be limited in a wilderness setting. And I talked about in previous videos an individual that was up in North Dakota, South Dakota, anyway, in a really remote location, ends up having a heart attack, and a bunch of people care for him and take turns giving him CPR, and they do it for like 90-something minutes. Anyway, he ends up surviving. That's an extreme case. Let's talk about when you need to stop CPR. And this isn't much different than if you're doing this in a traditional setting. If the victim revives, and that's unlikely, but if it happens, you would stop CPR, of course. If you're too exhausted to continue, if the scene becomes unsafe, so there's something dangerous occurring and your life is going to be threatened, if somebody with a higher level of care, man, I cannot read that at all. Let me rewind or delete some of that. Higher level of care can take over. So like EMS arrives, which is unlikely in a wilderness situation, but depends on how far out you are. And if they don't respond within 30 minutes, so if you're out in a wilderness survival, there's no response from them in 30 minutes, you can go ahead and stop CPR. Okay, when should CPR not even be used? When should you not even start CPR? If they've been submerged in cold water for more than 1 hour, no need to start CPR. If their core temperature is less than 50 degrees, if they're dead, that should make sense, or if they have fatal injuries, like their head has been decapitated, we wouldn't begin CPR. If their chest is stiff from the cold, or even rigor mortis, we wouldn't begin. And if you're too exhausted, or the scene becomes unsafe, just like above, or care is more than 3 hours away. So this is in a wilderness setting. So I just want to make that clear. We're talking about a wilderness situation here. So CPR and hypothermia, let's talk about that real quick. So here's the problem, and hypothermia doesn't just have to be in a wilderness situation. I kind of alluded to this in the cold related emergencies, but I want to talk a little bit more about it. The cold heart, like a really cold heart, is prone to going into VFib, ventricular fibrillation. So you want to be kind of cautious when you use some caution with somebody that is experiencing hypothermia and you begin CPR on them, and you'll continue until EMS arrives. Now, if it's a wilderness situation, all of these still apply that we talked about earlier, but this is saying that EMS can get to you on time, and it's hypothermia. It doesn't necessarily have to be in the wilderness. Then you would continue until EMS can take over. But all the other, if care is more than 3 hours away, you wouldn't have even begun CPR. So CPR and Avalanche Victim. This is a little bit more prevalent than it used to be in the past because we have a lot of people snowboarding and skiing. So we have a lot more victims. You begin CPR because what's going to happen is if they're unresponsive, it's because of hypoxia, lack of oxygen, and so the respiratory system shut down, and so therefore eventually the circulatory system will shut down. So treatment's the same, CPR. So give them CPR to get them back around. Let's talk about CPR and drowning. So with a drowning victim, this is where CPR differs. You're going to begin with rescue breaths. Because if you remember back to our normal CPR skills, and the person hasn't drowned, you begin with compressions. But in this case, you begin with 2 rescue breaths. Because a drowning victim, they have inhaled water, and so they've stopped breathing. The rescue breaths could potentially bring them back around if you get them out of the water soon enough. And then you do your 30 compressions. So it's kind of backwards from what you learned in the CPR chapter, but that we weren't talking about drowning then. And so a lot of these that I'm listing here are things that will happen out in the wilderness. So because people are on some sort of vacation, they're out and about, they're swimming, it's more likely to experience something like this out in the wilderness. CPR and a lightning strike. On this one, you're going to have to prioritize. So priority, the most severe, because you may have multiple people. Because if there's a group of people standing around, lightning strikes anywhere close to them, it might get them all. So you might have multiple victims, and so you're going to have to determine who needs care first. Let's talk a little bit about dislocations. My pen is messing up. Let me undo that real quick. And this is different than what you learned in the bone, joint, and muscle chapter. So we want to reduce. So before we were saying no reduction, but out in the wilderness we want to reduce. And mainly because it's easier to transport, because care is going to be delayed. So we're going to transport. It may cause a reduction in pain. It's easier to stabilize, and it will improve circulation. And out in the wilderness, this is really what we're concerned about here. If we leave this joint dislocated, it could cut off circulation, and since we're so far away from help, the tissue could die. So that's why in a wilderness situation, reduction is promoted. So reduction being popping the joint back into alignment so that the bones are aligned again. So popping it back into place. Spinal injury, because in a wilderness situation, a dislocation could potentially become a much worse problem, and the benefits outweigh the cost of reducing it out in the wilderness. But when you're in a normal situation where EMS can get to you fairly fast, reduction is not promoted. You want to wait to get a trained professional to pop it back into place. And this whole chapter talks about different ways to reduce joints, like fingers and elbows and knees and shoulders. So go through that. There's just too much for me to list in one video. So I just want to hit the key points and show you what was important. Spinal injury, stabilization. Because we don't want the vertebrae to somehow pinch on that spinal cord and do more damage. So we don't want to move around. We don't want little shards of bone cutting into it, because once nerve tissue is damaged, it doesn't repair itself. So stabilization is key. If they're sitting, we can use our hands. If they're already standing, we can use our hands. If they're laying down, we can use our knees or our hands. So there's several different ways. Just your knees may get less fatigued. It may be a little easier for you to stabilize them. We want to also make some sort of improvised cervical collar, and a lot of the stuff you're going to make out in the wilderness is going to be improvised unless you just happen to have it with you, which is unlikely. We take a thick blanket and make a soft splint, which is a cervical collar, around their neck and tie it off. Not too tight because you don't want to cut off their airway. So that's extremely important. So cervical collar, we want to, if they're already on the ground, you want to also support the rest of their body on the ground to make them as comfortable as possible without moving them. So you can stuff pillows and blankets around them to stabilize them so they can get comfortable. Avoid moving the person. So you want to send somebody to go get help if you have somebody. Try to call for help and help care come to them. You want to avoid moving at all costs. Sorry, I misspelled avoid. Avoid moving at all costs. And then if they're cold, if it's a cold environment, you want to warm them. Don't want them to experience hypothermia. If it's a cold environment, get them in the shade somewhere. I mean, if it's a warm environment, you want to cool them. And if it's a cold environment, you want to warm them. If it's a hot environment, put them in the shade somewhere nice and cool. Cool them down so they're not out in the heat. So, again, major points of the chapter. I didn't have a lot of time to go through every little detail. Definitely go back and look at the dislocations and learn how to reduce. This is a common injury. Splinting is also really important to know. So go back and look at the splinting chapter. Really good for wilderness first aid. So I just try to highlight some of the main areas. There are a lot more in this chapter, so go through and read them. I hope you enjoyed this video. I'll see you in the next one.